Hello, Dr. Cush here again. I just wanted to go over with you a few of the basic risks and benefits of some of these procedures that we're going to be doing in the world of foot and ankle surgery. When we talk about risks, we often start with the risk of bleeding, infection, and wound problems. They occur in about 1 to 2% of the general population. We also talk about the risks of bone healing, which we call non-union when the bone does not heal. In the general population, that ranges from about 5 to 7%. This can increase up to 20% in smokers, and that's why smoking cessation is so important prior to many procedures. After that, we often go into other things like DVT, which is deep venous thrombosis. That's a clot in your leg, and that occurs in approximately 3% of the patient population that are getting foot and ankle procedures done. PE, pulmonary embolism, occurs when that clot migrates from the leg to the lungs. That is something that's very serious and can kill you. That occurs in about 1% of the patient population. It is important for us to know if you have any blood dyscrasias that increase your chance of clotting, or if you've ever had a clot before. We will take the necessary precautions in order to thin your blood appropriately, whether that be with aspirin and or some of the other blood thinners that we use. Other risks include injury to nerves and vessels, and those are specific to procedures that we often do and the approach we take. And we'll discuss them on an individual basis during our encounters together. One of the other risks is swelling. Swelling is something that is 100% expected. This occurs probably about every patient I do a foot and ankle procedure on. The good news is that this will often get better as time goes on. The last major risk is the risk of loss of life or limb or toe. The chances of this are well less than 1% in the general patient population. And we just want you to make sure that you know what the risks are. That way we can take the best care of you here at Geisinger Sports Medicine. Thank you.